Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great video for those of you with sacroiliac joint pain. We're going to be talking about how to get your sacroiliac joint back into place, part 2 in our series, describing how to determine what your pelvic rotation is if you have an ilium that's rotated forward or backward, and then a great exercise to correct it, help relieve your pain, and stabilize your sacroiliac joints. Hope you enjoy. So as many of you have found out through trial and error, addressing sacroiliac joint problems and realignment issues with generic exercises and muscle energy techniques is not nearly as effective as a specific exercise targeted for your unique sacroiliac joint problem. We need to address the position of the bones around the sacroiliac joint to get them in a proper alignment, and we need to address the directions of motion restriction or tightness. If you're using a generic way of addressing your sacroiliac problems, you may inadvertently loosen a muscle here or there that gives you some transient relief. But when you know how to address your unique problem in directions of misalignment, you can restore normal alignment and decrease pain more effectively. So today, in part 2 of our series of how to get your sacroiliac joint back into place, we're going to be talking about the common problem of pelvic rotation. The pelvic bones, right and left, also known as the innominate bones, have a tendency to rotate forwards and backwards. Remember, these pelvic bones connect to that triangular bone at the base of your spine called your sacrum. Thus, the sacroiliac joint between the sacrum and the ilium bones on both sides is our targeted joint that we're going to be talking about. So remember that there's two basic ways that the pelvis can rotate, or the innominate bones can rotate. And if you've ever had relief from manipulation, many times the doctor or therapist is going to be talking about the pelvic bone has rotated forwards or backwards, or it's a posterior inferior or anterior superior pelvic alignment problem. So this is what happens. The pelvic bone, let's just say my right side, has two ways to rotate. It can rotate out of alignment forward, which is known as an anterior pelvic tilt on that side, or an anterior superior misalignment position, or it can rotate backwards, which is called a posterior pelvic tilt on that side, or that innominate bone, or a posterior inferior misalignment. So let's now figure out how we determine which is what, because we need to know this before we address the actual corrective exercise. There's several ways that you can do that. So the first way we can do this is by just checking our range of motion, what feels free and tight in terms of our leg movements. If I bring my leg forward and compare right to left sides, I may feel that one side doesn't go quite as high, or the ease of moving upwards feels restricted. It doesn't want to tilt forwards as much. And the reason that is because many times the pelvic bone has rotated anterior. That's called an anterior or superior alignment problem of the innominate bone, or the ilium. Because it rotates this way, it doesn't want to move this way. As the hip comes up, as the leg comes up in the hip socket, the pelvis likes to roll with that. So if I feel restriction, I can't go quite as high, or I feel tighter compared to the other side, many times that's indicating that that pelvic bone does not want to rotate that way because it's held in an anterior or superior misalignment problem. Now, on the other side of the coin, if I check my legs moving backwards, right and left, and I feel that one side feels more restricted than another, I could even use that as a stretch. I could put one leg forward and one leg back and see, does one side feel tighter in the groin around the hip? If one side does not move back quite as easy as the other, it indicates that the pelvis has rotated posteriorly, a posterior inferior alignment problem of the pelvis. And that's because in the hip joint, as the leg goes back, the pelvis should roll with it. It should assist that hip joint motion at the sacroiliac joint. And when it doesn't, and when it's restricted, it means it's because it's rotated the opposite way. It doesn't want to rotate forward. Now, a much more accurate way to analyze your pelvic motions at the sacroiliac joint, as well as the alignment of the innominate bones, is to use a bony landmark. So let's take the front of our pelvis. If we go to the crease of the groin, if we bend our leg up and down a few times, there's going to be an oblique crease that runs from our pubic bone up to this bone at the front of our pelvis called the ASIS. So you can just feel in that crease there, that dent where your leg attaches to your pelvis, upwards and outwards until you feel a bone. It's the only bone in that area, that ASIS bone. And if you feel that bone equally with your fingers, right to left sides, we can use that to analyze what's happened to our pelvis on that side and how it's affecting our sacroiliac joint. Now, if our innominate bone or our pelvic bone on that side had rotated forward, an anterior pelvic tilt on that side, also known as an anterior superior innominate malposition. If that's happened, that bone will have rotated down, so it'll feel perhaps a little lower. But more importantly, it won't rotate back upwards again. It's going to be restricted on that side. So you'll feel as you raise your leg on that side, that bone will not come up into your finger if your fingers are at the top of that bone, or if your fingers are at the very bottom of that bone, it won't rotate away from your fingers. It has difficulty rotating backwards because it's rotated forwards. Now conversely, if our pelvic bone or innominate bone on that side has rotated backwards into what's called a posterior pelvic tilt or posterior inferior innominate bone malposition, it's going to have difficulty rotating forwards because it's used to being rocked backwards. The muscles, the fascia around it have tightened and pulled the pelvis into that position. So therefore, it has difficulty rolling the opposite direction forward. And if you feel the front of that bone, that ASIS bone on that side, what you'll notice is if your finger's at the top of that bone, it won't want to drop away from your finger or move down and forward as you bring your leg back as much on that side compared to the other. So there's a whole bunch of different corrective exercises we can use for innominate rotation or pelvic rotation, but we're going to teach you a simple stretch and a strengthening exercise. Remember, both of these are designed to loosen up the muscular and the fascial tightness that is surrounding the pelvis and causing these problems, including the hamstrings, abdominal muscles, low back muscles. They're all going to be influenced by these two exercises. So let's take the first example where you've discovered on one side that your pelvis has rotated forward. You have an anterior pelvic tilt on that side or an anterior superior malposition of the innominate bone. If that's the case, we want to take that knee or that pelvis and we want to rotate it in what's called flexion. We want to move that knee up. So we can do that a couple different ways. So if my pelvis has moved forward, we want to move it backwards. We want to rotate it into a posterior pelvic tilt. So I can stretch by putting one leg up and the opposite leg back. Now if you notice what this is doing, it's taking the pelvis that's rotated forward and it's rotating it backwards on that side. And I could just maintain this stretch. In fact, it doesn't even have to give me a big stretch sensation. I may feel a little stretch on my hamstrings, I may feel a little stretch in my low back, or I could feel no stretch at all. Just holding this position for repetitive times is going to help to realign my pelvis. There's no magic formula in terms of how long you have to hold it for. You could use any stretching technique such as isometric relaxation, contract relax technique, whatever you prefer. But the bottom line is that's the position, that's the relationship between the front and the back legs that you need to do. You need to perhaps sit more with your right knee forward than your left knee forward. You need to stretch with that leg forward. You can do that on the ground with one leg back and one leg forward. The more time you spend in that position, it's going to take the pelvis that's rotated anteriorly on that side, and it's going to help to rotate it posteriorly. Now there's a strengthening exercise you can do as well, which is simply to use more hip flexion on that side. So again, if my pelvis on that side has rotated forward, I want to rotate it backwards with posterior pelvic tilting, meaning I want to flex the hip more. By flexing the hip more, I am activating my hip flexors and I'm relaxing my hip extensors, and that's going to take that pelvic bone, and after a few sets of 10, perhaps 2 or 3 sets of 10, you'll notice that your sacroiliac joint many times feels better because you've actually caused the pelvis to move into that direction of restriction. You're getting it to flex at the hip and cause a posterior inferior innominate rotation, which corrects that anterior problem. Now let's look at the opposite side of the coin. Let's say that my pelvis has rotated on that side into a posterior pelvic tilt or a posterior inferior innominate rotation. If that's the case, I want to take that side of the pelvis and I want to move it more backwards. I want to anterior pelvic tilt it back into alignment. So in that case, I'd switch my legs, and that leg of involvement, my sacroiliac joint on my right side, I want to be behind the other leg. Again, stretching this position, 15, 30 seconds, a minute, doing any stretch technique that you like, or simply just hanging out here where you can, throughout the day. If you're driving, making sure that the left knee is a little higher than the right. If you're sitting, raise that leg up on a little stool. The more time you spend with the left knee forward and the right knee back, that relationship between the two, the more it's going to realign, because it's taking that posterior tilted pelvis and driving it anterior compared to the other side. The greater the range of motion, meaning the greater the spread between the legs, the greater stretch that's going to be there. If you're in acute pain, you may not want that much of a stretch. You may have to use something as simple as just standing with one leg forward and one leg back. The more time you spend here, the more time the fascia, the muscles, the ligaments, everything's going to stretch back into a more corrective direction. You can also use this as a strengthening exercise. You can do repetitions with the right leg back. The more you bring your right leg back compared to your left for reps, you can squeeze the buttock on this side, because many times it's inhibited in these problems. It's going to take that posterior rotated pelvis and it's going to rotate it anteriorly. And again, you could do sets of 10, nice and simple, 2 or 3 sets, and many times afterwards you'll notice your sacroiliac joint feels better. So I invite you to try these techniques. Make sure it's based on an analysis. Remember, there are many ways the sacroiliac joint can get out of alignment. Posterior and anterior rotational problems are very common, but there are many more ways that the pelvis can rotate, and we discuss these in upcoming videos in this series. If you've enjoyed this, give me a thumbs up. Let's share it with others and help them with their sacroiliac pain. Questions or comments, write in. I'll do my best to answer. And remember, if you're looking for a great way to do a fuller analysis on your sacroiliac joint problem and discover even more targeted exercises for your unique situation with the sacroiliac joint, check out our fast-track self-rehab sacroiliac healing exercise program available at painfreeandfit.com. It's 100 pages of an analysis and a ton of corrective stretches and exercises and even walking modifications to help you get your sacroiliac joint back in place and relieve your sacroiliac pain. I hope you have enjoyed this video on pelvic rotation and sacroiliac realignment exercises.